Hello and welcome to our poster, Emergency Medical Services Provider Acceptance of and Attitudes About PediatricSimBox Simulations. I'm Marc Cicero. This project is part of our ongoing Targeted Issues project that looks at the role of pediatric emergency care coordinators in improving the quality of care for children in the pre-hospital setting. What we were examining here was the use of SimBox, a self-contained simulation curriculum that includes all the facilitation prompts, information about patients, and debriefing prompts that are necessary for EMTs and paramedics to improve their care of children. In this study, the pre-hospital providers who participated in SimBox were providing their opinions about SimBox. Participants went through the simulations in teams of two, either a paramedic and a paramedic, or a paramedic and an EMT, or sometimes two EMTs. Simulators were used that were low fidelity, and the facilitator was either a PEC or an agency training officer or a pediatric emergency care physician or general emergency physician. The scenarios included seizures, sepsis with respiratory failure, and child abuse, and debriefings followed all of these scenarios. The data were analyzed by case type, participant type, location, meaning Rhode Island, Connecticut, or Colorado, the sites of our study, and participant reactions were recorded, including the simulation and the debriefing. Finally, we calculated net promoter scores that were used to assess participant endorsement of SimBox. I'll start with that as far as the results. Fully 70% of the participants were active endorsers of SimBox as a way to learn, and very few were detractors. Almost all the participants agreed that this was a good way to learn. Let's roll up our sleeves and look at the results by domain. First, in the pre-briefing, we can see that as far as self-reported confidence, 89% of the participants reported an increase in their overall confidence and strongly agreed with it, or 89 total participants, that is. And another 32 said it somewhat improved their confidence. None of them said it didn't improve their confidence. We can work our way into the scenario, which shows that by and large, most of the participants agreed that they were better prepared to changes in the patient's condition, their physiology, and that they felt empowered by participating. The debriefing was felt to be one of the most strongly endorsed components, and it's often said that we do simulations in order so that we can debrief and better understand what we've done and any gaps between what happened and what ideal practice looks like. On the whole, again, there was a high degree of agreement that the session was worthwhile as an educational exercise and that it improved pediatric acute care. In total, there were 121 total participants, most of whom were paramedics. The participant agreement with that this was beneficial was quite high, and 98.4% strongly or somewhat agreed that they were more confident in prioritizing care and interventions for critically ill children. In conclusion, simulations done with SimBox are associated with improved self-efficacy of pre-hospital care providers for the care of acutely ill or injured children and can be widely used for both BLS providers and ALS providers. The majority of participants promote SimBox as a learning tool, and this suggests that SimBox will have wide acceptance among EMS learners. Thank you very much for your attention and enjoy the rest of the conference.